well, we're going to have new professions that will be licensing individuals as well. So psychotherapists, kinesiologists, they're already registering. Traditional Chinese medicine, they're already licensing practitioners. Homeopaths and naturopaths. So our field is growing. And interestingly enough, we have a very large variation in the number of internationally trained members in each of the professions. So for instance, in terms of proportions, 41% of pharmacists licensed in Ontario were trained internationally. So this is a full 41% of the total number of licensed pharmacists were trained outside of Ontario, that is internationally. Some people might think that we have a lot of nurses who are internationally trained. We do, but nursing is a very, very large profession. However, 11% of the members are actually internationally trained. So while the profession has approximately 18,208 members who are internationally trained, these are last year's figures, 11% of the total number of nurses who are licensed are internationally trained. Then a lot of people might not believe this, but a full 29% of physicians in Ontario are internationally trained. And I think you'd be surprised to learn that that's close to 11,000 physicians who are internationally trained. In some professions, what's happening, which is very interesting, this is true for audiologists and speech-language pathologists, chiropractors, even physicians, but less so. They're more internationally trained outside of North America, actually. A lot of the individuals are trained in the United States, but they are part of our internationally trained cadre. So it's, you know, that happens in some of the smaller professions where the number of spaces available for individuals who want to enter these professions within Canada or within Ontario is limited, so they go outside. So a recent phenomenon, and we're seeing more and more of this, is that many Canadians, our children, often go to study in a profession outside of Canada. And this is very true for physicians. So these individuals who come back are competing with immigrant professionals for, you know, the coveted residency spaces. And obviously they have an advantage because they speak the language, they probably did their undergraduate degree here or a second degree here, they're much more comfortable here, and they know how the system works. They go overseas outside, they get their degree, they come back, and they're much more likely, in fact, to get a residency space. So we have the landscape shifting, we have a lot of allied professionals who will become licensed. Certain professions like traditional Chinese medicine, the name speaks for itself. Naturopaths and homeopaths will have a large number of internationally trained applicants and members eventually. And so the landscape and the composition of IEHPs is going to be changing, and you will be coming into contact with more of these individuals as they apply to get licensed. One very interesting thing, and I think you'll find this interesting too because of some of the steps that regulators have taken recently. So representation of internationally trained licensees can be even higher than the 41% that I mentioned for pharmacists. For instance, the National Dental Examining Board of Canada reports that 46% of dentists that were licensed in 2012 were trained outside of Canada. It's a very large proportion. So things are changing, but like I said, you have to put in that mix individuals who were maybe trained in the United States, Australia, the UK, where if you come from those jurisdictions, it might be easier. It's still difficult, but it might be easier for you to get licensed. So that was just to give you an overview of the numbers that we're talking about. And I think you probably know this in your work. The main source countries of individuals who are applying for licensure, continue to be India, the Philippines, and, well, Australia, the US. US is actually still pretty significant, and the UK. So one of the things that we are interested in looking at is which countries does Canada have mutual recognition agreements with? You won't be surprised to know that most of those countries happen to be the former, Commonwealth countries where English is a common language. And that is not necessarily the composition of the applicants. So people coming from India and the Philippines, there are few mutual recognition agreements, and in fact in healthcare it's very rare to actually have that. Now there are many resources available for internationally educated professionals. So you are very much involved in providing services and guidance to those individuals. You'll hear from Wayne Oak from Health Force Ontario. They also provide support and guidance to individuals. And TRIAC has professional immigrant networks that we've been meeting with to learn more about their experiences. And certainly we do hear from CARE and the experiences of internationally trained nurses. I think one of the issues that we are grappling with is that when a person comes here and says, I want to practice as a nurse, or I want to practice as a physician, there's a lot of weight, that's carried in that statement. And what we find often is people are saying, well, you may not qualify to be a nurse or to practice as a physician. Let's find you an alternative career. I think we have to be really careful about how that is handled. Now, I know that there are some alternative career pathways that are being explored, but it's a very important issue because it's tied to the self, to the individual who's been practicing. They're not novices. They didn't just start their career. They were practicing. And in their countries of origin, many times, the status of a doctor or a dentist and other healthcare professionals, nurses included, is very important to them. So I just want you to keep that in mind as you reflect on what you're hearing and our discussion later. Now, I have to tell you that I cannot see the clock, and I think we had somebody who was going to hold up signs for me so I can keep track of our time. So I'm going to stop there. I will tell you, well, if you haven't heard about the Office of the Fairness Commissioner, it was set up in 2006 primarily because lots of your clients and people we know, relatives, friends, who've had difficulty getting licensed in their professions and could not find jobs in their professions. So the government decided to do something about it, and our legislation looks at problems at a systemic level. So what are the steps involved in assessing your qualifications? How can you make that more streamlined and simpler? We look at those kinds of things. Can you appeal a decision to a body if you disagree with their decision? Can you have a review of your exam results? So those are the kinds of questions we ask regulators. Are you doing this? How are you doing this? Is it fair? And we've been doing this now for 6.5 years. We have seen some progress. So we have seen more processes being streamlined. We've seen more mutual recognition agreements, but not enough. We have seen some requirements for Canadian experience actually eliminated as a result of the work we've been doing. And there are many more alternatives available to individuals. So for instance, you'll hear about bridging programs like CARE. These help people get reintegrated into the professions and work towards licensure. The problems persist, particularly when it comes to certain requirements. So just about every single profession, well, there are some that don't have an exam, but most of them do. And exams can be very challenging. I mentioned the residency spaces for physicians. There are only 200 for more than 1,000, 1,100 applicants in a year. So a lot of those are going to our kids who go to train as doctors elsewhere. But like almost 60% of those 200 spaces are now going to non-immigrant applicants. So I think we have some challenges. We also find that a lot of programs that are offered cost money. There are not enough spaces in some of the bridging programs and the education programs. So we work with government, we work with the regulators, we work with bridging programs to see what else can be done. It's a long process, it's complicated, and we're trying to make it less complicated, but it still needs a lot of work. And we're here to hear from you about what else can be done. And we hear from some colleagues about what is being done.